There was a World Health Organization program called COVAX, where the aim is to get vaccines to everyone in the world by the end of next year, by the end of 2022. And I think that's still the plan. But I would like to see that happen more quickly. Unfortunately, though, if some of the vaccine suppliers are going to high income countries for third doses, those doses can't then be used to speed up vaccination programs in lower income locations. So I'm a little bit unsure what's the best way out. But one thing I have proposed is the idea of using smaller doses for boosters, because we know from the data in clinical trials already, the boosters, the third dose of Pfizer, Moderna, and other vaccines would give very, very strong immune responses. And actually, if we were to reduce the dose, for example, giving people a third dose of half a dose instead of a full dose, actually, it would still be a really, really good boost, but it would save the doses then, which could then be used in other parts of the world where they so desperately need them.
Which part of the world most desperately needs those first shots right now? Where's really calling out for coverage?
Well, here in Asia, actually, if you look at Malaysia, Thailand, Indonesia, the numbers are still going up despite lockdowns, and really, really need vaccine supplies more quickly. The more quickly supplies can come in, the more quickly they can be used, and they can save lives. A lot of lives could be saved in the coming 3 months, coming 6 months, if vaccines were available more quickly.
Let's talk about, of course, what is happening here in Asia. You mentioned some of those areas, Malaysia, Indonesia, Thailand, where we are seeing lockdowns, but also record numbers. But also in Australia, where today there were 633 cases in the state of New South Wales alone. Why aren't these lockdowns working when I'm hearing from people in Australia every day they're absolutely not leaving their houses?
It's really tough to stop the Delta variant from spreading. It's more transmissible than the previous strains, maybe 2 times as transmissible. And that means that the measures we used in the past to get COVID under control may not work as well for the Delta variant. They may not be enough. But it's hard to see what more could be done in Australia. So I think it's going to be a really tough month or two ahead to get the numbers back down to 0 in Australia, get the vaccination coverage up to a higher level, maybe 70% plus. And then at that point, can follow the Singaporean approach, which is very sensible, to say once we're above 70, we start relaxing. Once above 80%, relax more and see how it goes step by step.